Today we're going to talk about a lateral shift in the back. We're going to get into why this happens and what you can do to fix it with several techniques that we use in our office all the time. But let's get into what a lateral shift is. Typically when you see someone coming into the office, they kind of look like this. They're kind of shifted, their hips are shifted one direction and their shoulders are going the other direction. And this is what we call a lateral shift. Now, there are sometimes we have cases where they can kind of pull themselves up straight, but they still kind of want to go away from that direction. And there are two different exercises that we do based on what we see in the office, and we're going to go through some of those. But first, let's get into why. Why does this happen? So a lot of times people get back pain. And if they get back pain, let's say I'm getting back pain on my left side, what they want to do is they want to open up the space. So they're just kind of shifting, or they'll sit to one side like this and to open up that space because it will feel better. Because if they close down on it, it hurts and they're not really sure what direction they need to do. And so if you're always shifting to one side in this direction, what happens is those bones will end up shifting this way. And when that happens, it's like you have one bone on top of the other bone and they just go like this, which is kind of why the hips go this way. One bone goes this way and the shoulders go this way and the other bone goes that way. So when someone comes in and with it, this lateral shift, and they visibly look like this, and we can't get them, and they can't get to being straight, then there's only one exercise that we really go to doing to help with this lateral shift. Now, when we look at like kind of pain location, typically people are moving away from the pain. So the pain is going to be on this side. Now, if the pain is on the other side, completely different. Make sure you give us a call, because what we have to do for something like that is very different. And we really need to see you to really understand what is going on. You can also, when you shift this direction, can have pain go down the leg. And the reason why is the nerve, you can pinch a nerve right in the back because you have these nerves that go right in the back. But you also, from the level above, with this nerve up here, it comes down and it comes to the side. So if you go in and we have a herniation out here, the nerve above can pinch on it, which then also can give you pain down that leg. So we want to basically use our body to shift the material all the way back in. So we want to pinch through here to move the material in the opposite direction and to get the bones to start lining up. So I'm going to show you the first exercise that we're going to do to fix that part of it, and then we'll get into the second scenario, the second situation where we do something different. Now, if I'm shifted this direction, I want to make sure that my hips go in the opposite direction. Now, for purposes that I'm going to show you, I'm going to go this way. So let's say my hips are shifted to the right and my shoulder is shifted to the left. I want the left side to be on the wall, away from the side that your hips are moving towards. So if you come through here, you want your elbow on the wall and you want your shoulder on the wall. You don't want your shoulder off the wall. You want to kind of relax into this. You're going to allow gravity to kind of push in as you push it in and then come back out. And then push it in and then come back out. So you want the hips to go underneath this elbow as you kind of go in. You can hold it if it feels really good. That's great. So just, again, it's kind of like pressure on, pressure off. You don't want the knee to be bent because then you start rotating your hips, and we don't want that. So we want the legs to be straight as you push the hips in. Now, when you have something where you've been visibly shifted here and we're trying to fix this, guess what? We live in this plane. We call this the sagittal plane. We live in the plane. We walk in this plane. We sit. We're always constantly moving in this plane. And this plane will irritate anything that's lateral. So if this is something that is helping, you need to do this every hour. I would do 8 to 10 every hour, because we've got to get you over the hump of living in the sagittal plane, because that's just going to constantly irritate it. So every hour you're going to want to do these side glides with the, again, shoulder opposite of where the hip is moving towards, so that you can get over the hump of feeling better. And so that is the exercise that you do if you're visibly shifted. Now, if you have pain and you kind of shift away from it, so the pain's on this side, I'm shifting away from it, but you can kind of get back to midline, and your story is man, I hurt when I walk, when I sit, when I lie down, then you're going to want to do something different. If you notice that when you lie down, you feel better on your side, or you feel better rotating like this, you'll look like this, these are positions that when you lie in that you kind of get a little bit of relief, then there's a completely different direction that we want to go into. So again, I'm going to show you the opposite way because of the way the camera is. But if I'm shifted this way, we're going to go hips to the left now, shoulder to the right now. What I want to do, sometimes what happens is you can have more of a herniation more in the front through here. And when that happens, where it's more kind of front lateral, this is the exercise you want to do. But typically when you see something like this, you're going to be able to get more straight. You're not going to look so shifted. You may feel shifted and then kind of come back up. I'll shift this direction. May feel shifted and then you can kind of come out of that position. But you hurt sitting, walking, everything hurts you, then, and you're not like visibly shifted like this, and maybe you are, but you can kind of get to midline, then you're going to want to do this exercise. And a lot of times it's because the herniation's a little bit more in the front part of the disc, not necessarily laterally, and you're not necessarily, the bones haven't shifted this direction, which is perfect when you do this exercise, but you actually will feel better doing the exercise I'm about to show you. So again, let's go, hips are this way. What we're wanting to do is we're wanting to clamp down on this side, but we're going to do it in a non-weight bearing position. It'll feel better doing that, and you're going to want to clamp down over here. So if your hips are going to the left, then or your pain is on the left side, then we want your knees to go towards the left side because we want to kind of clamp down on this side. I'll show you a visual here in a second. So what you'll do is you'll bring one knee up, bring the other knee up, you bring them over to the side. You can start out by rotating like this and just breathing. If this is too much, you can always put a pillow and start here. Usually people can kind of tolerate this. What you don't want to do is start here and then rotate here because you're getting the rotation from the upper part of the back, and we want to get the rotation from the lower part of the back. So you have to go bring the knees up, rotate the lower part of the body while the upper body stays the same, and you're going to hang out in this position. This position, you're just going to hang out as long as you can. Again, if you're in that lateral herniation, everything you do in life is in the sagittal plane. That's that front. We're always walking, sitting. We're always moving through there, which will irritate this. So you're going to have to do this as often as you can. I usually tell people on the weekends, just if you can hang out in this position for a long period of time and do it often, you're going to get over this much quicker. So if you want to progress it, then you can put the top leg out and then drop it in front so you can get a little bit more rotation through there. So you just can kind of hang out in this position. This is the progression of making everything rotate just a little bit more to kind of hit that end range. So again, holding it for a minute, 2 minutes, 3 minutes, as long as you can, you are going to feel so much better. And so if I use this model, and we're going to be flexed and rotated, you can kind of see if I flex forward and rotate, you're going to put pressure in through here to move all that material to the back, back into the center, away from the area that's damaged to allow things to heal. And so when you can push it away from the area that's damaged, it's kind of like if you have a scratch on your arm, you're constantly stabbing it, you're going to feel a lot of irritation. It's never going to heal. Well, if we're constantly stabbing this area, you're going to have a lot of irritation. It's never going to heal. We've got to get the pressure off that, and that's what that flexion rotation does. When we use flexion rotation, again, they may be limping a little bit. They definitely have pain with everything that they do. They typically can get a little bit of relief lying on their back and rotating towards the side of the pain, they'll start telling us, this is the position that I feel better in, and we pretty much know we need to do that, especially when they're not visibly shifted. They will tend to want to sit off to one side. If this is the side of pain, they'll want to sit off to the one side, but they can get back to this plane right through here. The other scenario is they're shifted and they can't get back. And if they're shifted and they can't get back, you have got to do the first exercise where you're doing where you're moving, standing in the wall, moving the hips into the wall to get the joints to kind of go back to the center so that you can get some pain relief. So if you try these exercises, you're going to want to do them often, every hour, because we live in this plane through here and our problem is in this plane. That's a problem. So you've got to go and do it often to get over the hump. If you're noticing this and you're not feeling any better with this, make sure you get to someone that understands the back, because there's other components, there's other things that we can do to help improve your situation, but it really does take an evaluation to understand what's going on with you. And are there other components that we have to look at? So if that is you, make sure you reach out. In the comment section or the description section, you will be able to find links where you can reach out to us to start the process of working with us, as well as other resources that we have in that section. Again, subscribe to our channel. If you have any back pain, comment in the comments below. Let us know what you're doing, what you've tried, so we can kind of help you navigate that as well. And we'll see you next time.